Hi, this is Roy Liddy. Well, as you know, I've been in Australia looking around at the Australian healthcare system where people have been very generous and shown me all sorts. What really strikes me is that we're all kind of struggling with the same thing. Not enough money, too many customers and not enough staff. And of course, the big issue is dementia. I've come to see Dr. Tuly Rosenfeld, who is a specialist in caring for people with dementia, but working in the community. Now, this is a kind of model that we don't see in England. So Tuly, just in short, tell us what you do.
Well, I'm a geriatrician. I see older people, not always older, but some younger older people with a range of medical problems, and often I see people with problems that actually are masquerading instead of the real underlying issue is early onset dementia. And I must say that the dementia industry tends to name people with having dementia many years after their cognitive problems have kicked in. They have problems with thinking and decision making many years before somebody diagnoses.
So in the UK, we've had the kind of debate about should we be paying GPs to do early diagnosis of dementia. We paid them, I think it's £50 for a diagnosis. That program, I think, has come to an end now. And of course, guess what? All of the diagnoses of dementia went up. But it seems to me, even what we define as early diagnosis is actually not early enough. We were with some researchers at the hospital here yesterday, and they're saying, you can pick up signs of dementia 20 years before it starts to manifest in symptoms.
So if you walk down the street, you can actually identify the elderly lady or man who isn't putting out their garbage in time. And the daughter's arriving every day by car to organise the bills and empty the mailbox and stuff like that. That sort of an older person goes to their GP and doesn't get picked up with dementia. And they do silly things like the Falstone mini mental state, which it's just a screening test and doesn't pick up that early decision-making those problems. And the real issue is that when you start to have those decision-making problems, some of the things that we do for ourselves start to fall away. So we look after our diet, we go to the doctor when you need it. The problem is that the people who really need to go to their doctors, if they're failing and their memory is not as good as it used to be, and their decision making is not as good as, they don't tend to go to their doctors. And if they've had a fall, I've just had a fall, that's okay, I'm allowed to have a fall. How many times have you fallen in the last year? Well, an older person who's fallen, that's a warning sign that something's seriously wrong. It's not just dementia. One of the things that doctors tend to omit is the fact that everything comes from the brain. It's not just your dementia and your memory, it's your walking and your ability to organise your affairs and pay the bills and look after the kids and drive, and all those sort of things are impaired even in the earliest stages of dementia, or earliest stage of cognitive impairment.
Central theme, really, I think, of your sort of philosophy of care here is we over-medicalise it.
We over-medicalise it. We do a lot of stuff, and it's a trade secret, and I don't want to tell my patients, but a lot of the things that I do is really just screening stuff, making sure you don't have a brain tumour, things like that. Okay, they're important at some stage, but they're things that somebody with the right training can pick up very early. You know that you don't have to go through a million tests and blood tests and scans and all those sort of things if you can't put out your bins anymore. You don't need to see a doctor, but you need to have somebody who's properly trained, who can pick up on the key markers, who can identify the fact that you're beginning to fail because you've got risk factors like you're a heavy smoker, you've got chronic lung disease, or you're a drinker, or look at your medications to see that one of the reasons you fell over 3 times was you're on the wrong medications. Somebody that you don't need to be a GP or a specialist to be able to say things are not quite right. We need to have a look at that stuff. And nurses pretty much intrinsically already know some of that, but they need to be skilled and trained better.
So one of the solutions that you've come up with, this is really interesting. It's called Care Pilot. You'll tell us about it in a moment. This is your brochure, and we'll find a way of putting this online. So here's the online address. this is a way of approaching it. It's not entirely replicable in our system because the payment system is kind of different. But nevertheless, the service philosophy is really interesting.
Why are people that I see failing so badly? It's not because an individual doctor, it's because the system does not support carers and families to do the things that are necessary to support their elderly people. And so the system issues that keep on failing, we've done research at Prince of Wales Hospital, the system issues are that GPs sitting in their offices are not the best ones to be able to identify and call out the needs of older people. You need to have somebody on the ground, and the systems that I have tried to build over the last few years, including with New South Wales Government, was a thing called we actually called it safety, subacute fast track elderly care. So that when an older person fell or they were a bit confused, there was a team that came out from the hospital, came into home, and actually what we call case managed them. We actually had a case manager, a nurse who was trained, who knew how the system worked, and was able to say, these are the things that we can do, these are the things that we need to deal with to exclude diagnoses, these are the physiotherapy or whatever it is. You need somebody who knows the system, who knows how to work the system to be able to advocate for patients and their families. We developed this care pilot is the private side of what that sort of system is talking about. So it's enabling carers and families to get online and talk to somebody either online or on the phone who understands the system, a care manager. And the care manager can be any sort of a health professional, because by being a health professional they understand the language and the dialogue, and also they can talk to a GP and have a reasonable conversation without the GP getting on their high horse about not talking to a health professional. And the care manager can then advocate on people's behalf and give advice, put them in touch with services. It's evolved onto an online service, and so the idea is that you can scale that sort of ability to inform people, to connect them to the right services. You can scale it so that one person on the end of a phone can look after hundreds, maybe thousands, if it's a good system, of people giving them the right advice, getting them care on the ground. And the thing that I see all the time is families who are trying to do the right thing are spending enormous amounts of time, and there's a huge opportunity cost. People, lawyers who I've seen here, giving up their job so they can look after mum, and they're providing all this care, but they don't know what to do. And they go to their GP and they get sent to a specialist, they have lots of tests, and at the end of all that money, all the end of all of that time, they're still in the same situation, having given up their job, sitting there at home trying to sort things. And even if they get care provision, there's no one controlling the thing. There's no one controlling who knows the system. And let's face it, the GPs sitting in their office, they're not at home, managing things. You need either an online support or an online support with people on the ground who can do that sort of stuff.
Tuly, it's fascinating to talk to you, and thank you very much. And hopefully we'll be able to talk to you in the flesh in the UK at one of our conferences very soon. So thank you very much for your time. And I think I finally found someone who's given me inspiration and hope about the future of dementia. Thank you very much.